been a nursing technician in an inpatient rehabilitation hospital. Throughout my time as a nursing tech, I have seen various diagnoses, from as simple as a shoulder dislocation to as complex as Guillain-Barré induced from a flu shot complication. However, the most common diagnosis among my patients is stroke. Every 40 seconds in the United States, an individual has a stroke. It is not yet possible to completely inhibit strokes from occurring, but we can improve our rehabilitation strategies to minimize their life-altering effects. One of these rehabilitation strategies is manual therapy. Manual therapy is a rehabilitation method where practitioners use their hands and tools to manipulate soft tissue to improve mobility and functioning. Manual therapy has been studied extensively in the young and healthy population, but is lacking in the diseased population, like those who have been diagnosed with a stroke. Therefore, the purpose of this study was to examine the effects of manual therapy in stroke patients who have upper extremity impairment. For this study, 7 patients who experienced a stroke within 2 weeks of participating were recruited from an inpatient rehabilitation hospital. Patients were randomly assigned to one of 2 groups, a traditional stroke rehabilitation group or a traditional stroke rehabilitation group with an emphasis on manual therapy. Participants completed 8 to 10 treatments with their practitioner over 2 weeks. The participants were evaluated using the Fugl-Meyer Upper Extremity Scale and the Quick Dash questionnaire before and after treatment. Results showed that there were significant differences for both scales between pre and post treatment. However, no differences were seen between the 2 groups for any of the measures. Based on the results from the study, an emphasis on manual therapy and post-stroke rehabilitation cannot be considered the key responsible factor for improvement in physical and motor functioning among participants in this study. This suggests that while it is known manual therapy is beneficial, it is still unclear on the specific amount, intensity, and duration needed for optimal results in the return of upper extremity function.